Before your endoscopy appointment, you may be contacted by a member of the pre-assessment team. They'll ask you some questions about your medical history and give you information about bowel preparation if you're coming in for a colonoscopy. On the day of your appointment, you'll be greeted by a member of the reception team. They'll confirm your details and ask you to take a seat in the waiting area. A member of the nursing team will take you to an admissions room where your blood pressure, heart rate and temperature will be recorded. They'll ask some questions and insert a cannula into your hand or arm. If you would like sedation, you'll need to arrange for someone to collect you and stay with you for 24 hours following the endoscopy. This will be clarified during the admissions process. You'll then be escorted to another waiting area. Here you'll be asked to change into a gown. Alternatively, you're welcome to bring your own dressing gown. You can wear your own clothing if you're having an OGD or bronchoscopy procedure. Some patients may require an enema. A nurse will advise and administer accordingly. Before you have your procedure, a doctor or nurse specialist will discuss the specific endoscopy with you and gain your consent. You'll be asked to sign an electronic form. You'll notice a number of patients there who are on different lists, so they will all experience different waiting times. Endoscopy staff will try to keep waiting times to a minimum, and they'll keep you informed as much as they can. If at any point you require any assistance, please do alert a member of our nursing staff. There are call bells within each waiting area. You'll be then escorted into one of the procedure rooms and asked to take a seat in a trolley. There'll be an endoscopist, a team leader, a procedure nurse and a healthcare assistant in the room with you. Sometimes there may be trainees present too. Here you'll be asked to confirm your identity and you'll be attached to monitors. If you're having sedation, you'll be given some oxygen through your nose. If you're having an OGD procedure, bronchoscopy or ERCP, you'll be given a local anaesthetic spray in your mouth. As you swallow, this will cause a numbing sensation at the back of your throat, which may feel strange. The nursing staff will explain what to expect. Once the spray has been given, a mouth guard will then be positioned to hold your mouth open. You'll then be helped into the correct position. You will now be sedated if appropriate via your cannula. The lights will be dimmed and the scope will be passed either through your mouth for OGD, bronchoscopy and ERCP procedures and through the rectum and into the bowel for colonoscopy and flexible sigmoidoscopy procedures. Endoscopies vary in length but average between 10 to 30 minutes depending on which procedure you're having. Once it's complete, you'll be taken to the recovery area. Here you'll be monitored for around half an hour. Your cannula will be removed after your recovery time. You may be asked to take a seat in the discharge lounge where you can wait for your lift home and if appropriate, nursing staff can provide some food and fluids. A member of the endoscopy team will provide verbal and written information about post-procedure care and contact numbers for any further advice or concerns. While you're waiting to be collected, please take the time to complete a patient feedback form. Thank you so much for watching.